Hello, I'm John Kanellopoulos, an eye surgeon based in Athens, Greece, and clinical professor of ophthalmology at NYU Medical School in New York City, New York. It is my pleasure to introduce to you this manuscript, manuscript 4455, which explains a novel technique and technology to assess collagen cross-linking with anterior segment OCT. We believe that this standardized method can be used as a benchmark to compare different OCT fluences, different OCT devices, riboflavin concentrations, etc. As you will see further in this video, we introduced the concept of utilizing anterior segment OCT to describe the demarcation line that was previously described by Hafesi and Seiler clinically on the slit lamp, this time though using an anterior segment OCT. We use the OptoVue OCT from Fremont, California, as a vehicle to image the corneas after collagen cross-linking and evaluate carefully the hyperreflectivity evaluated by this OCT within the cornea and the limit where this hyperreflectivity, starting from the anterior part of the cornea going posteriorly, reaches a line like structure which has been described and we feel is the inner limit of effective collagen cross-linking. Why is this important? It is important in order to be able to assess whether there is enough cross-linking in the cornea. In an era that we still do not have a standardized way of assessing the amount of cross-linking achieved, this may be a tool to evaluate not only the depth of cross-linking but also the width within the cornea surface of cross-linking and get an idea of the volume of cross-linking achieved. Also, by standardizing the luminance and saturation of these images on corneal OCT, which can be different from patient to patient, we can use, using a digital method, a standardized way to assess the hyperreflectivity in the cornea, thus having two parameters to measure: the volume of tissue that has been cross-linked and the intensity with which it has been cross-linked. We evaluated several of our cases. We have currently performed over 1,500 cases with collagen cross-linking, most of them with the Athens protocol. That's a combination of topography-guided PRK normalization and high-fluence collagen cross-linking. And we were able to obtain reproducible data convincing us that this tool is a valuable tool in the assessment of qualitative and quantitative effect of cross-linking in human corneas. Let's go on and see the specifics. You can see here the originally published demarcation line on the corneal OCT. This is from the Journal of Refractive Surgery, September 2009. And here, how we assess with the OptoVue anterior segment OCT the demarcation line. You can see here is at a depth of about 70 to 80%. Centrally, it goes a little bit shallower peripherally. And by digitizing this image and taking out the saturation and bias, we determined the actual depth of demarcation line in these cases that had collagen cross-linking. You can see here, also noted in the paper, the wide range of follow-up all the way from early follow-up, first year, to 5 years. And as I noted previously, most of these cases are Athens protocol cases. Here you can see the actual demarcation line depth with ranges from 50% to almost 90%. The average is about 70%. And these are clinical examples noted also in the paper. Some extremely thin corneas cross-linked. You can see demarcations lines range from almost 90% to 50% in other cases. So in conclusion, I thought you found this description of our method elaborative. We have concluded that by using anterior segment corneal OCT and our digitized method, you can have qualitative and quantitative assessment of the effective collagen cross-linking achieved in human corneas. I thank you very much for your attention.